Hello there, I'm Tracy.
Hello, I'm Karen and we're from the Eve Appeal.
Karen and I run a service at the Eve Appeal called Ask Eve. The idea of the service is that women and the men that worry about them can call in if they're worried about signs or symptoms of gynaecological cancer. I run a gynae cancer service at a hospital in the West Country, so I'm well placed to answer up-to-date clinical queries and questions, worries and symptoms about gynae cancer.
And I actually had cervical cancer when I was 24, so I'm the important one. But seriously, I'm one of 58 women who are diagnosed with a gynaecological cancer every day in the UK. And sadly, 21 of those women won't be alive in 5 years after their diagnosis.
Today, we're here at the home of our friends Pink Parcel.
Yay.
We want to talk to you about signs and symptoms of gynaecological cancer.
First up, we have ovarian cancer.
Let's remind ourselves where the ovaries sit in our gorgeous bodies. Okay, we girls have a womb, our vagina and cervix, the fallopian tube, and attached on either fallopian tube are our lovely ovaries.
So ovarian cancer is the second most common of the gynaecological cancers, but it's the one with the worst outcome because the symptoms are very, very sneaky. They're often confused with other less serious conditions.
Those symptoms in the main are change in bowel habits, so that could be diarrhea or constipation, something that's not your norm. Feeling full after eating, not wanting big meals. Feeling bloated in your tummy area. An increase in your waistline or your girth, having to go up a couple of notches on your belt. And the key thing to remember is, it's not that one-off occurrence after the curry that you had last night, it's if it's persistent for 3 weeks or more.
So next up we have womb cancer, which is the most common of all of the gynaecological cancers. Over 9,000 women are diagnosed with womb cancer every year in the UK. Tracy, where's the womb?
I'll remind you, Karen.
Thank you. Oh yeah, there it is.
Here's the womb. Okay, signs and symptoms. You shouldn't be bleeding outside of your menstrual cycle. So if you're postmenopausal,
if you've had sex, let's just talk about sex, baby.
She always talks about sex, baby.
I love sex.
If you bleed after sex or bleed in between your periods, or if you're menopausal, that shouldn't be happening.
So next up we have cervical cancer. So cervical cancer is the reason we have smear tests in the UK. They look for abnormal cells in the cervix, which if left untreated could potentially turn into cancer. Tracy, where's the cervix?
Thanks, Karen. So, here we go. The cervix sits here.
Actually, no, this is my moment. I had cervical cancer, so now I'm going to shine. So, I had abnormal bleeding for a few weeks before I went to the doctors. So for me, that meant a little bit of blood in my discharge, and a couple of times after I had sex, there was a lot of blood. And that was really, really scary. And my boyfriend at the time said, "Oh baby, is it because my dick's too big?" Have you ever had that problem, Tracy?
Never.
Me neither. So obviously I was really scared and I went to the doctors, and because I'd gone after only a few weeks of bleeding, I was really, really lucky and my cancer was caught at a stage 1B. So ladies, if you're having any type of abnormal bleeding, like we mentioned before, please go to the doctor because it is a key symptom. Number 4 is vaginal cancer. Yes, that's a thing. Tracy, where is the vagina?
Hidden on the inside. I'll show you. Signs and symptoms, Karen.
Right, well here we go. That's nice, isn't it, Tracy? So signs and symptoms of vaginal cancer are quite similar to cervical in the abnormal bleeding, you know what that is by now, and abnormal discharge, a bit of blood in the discharge, but also anything that feels different like a lump or a bump inside the vagina is worth going to the doctor with. Last but not least, we have the vulva. Tracy, please show me your vulva. And here's my vulva, but the pictures aren't to scale, just to confirm.
As you can see, our vulvas look different. So just as everybody's nose on their face looks different, every woman's vulva looks different. We want you to go home and have a look at your vulva so you know you're normal. That's because then you can check out for any signs and symptoms, which are, Karen?
An itchy vulva, any changes in the skin colour or texture around your vulva, and any lumps and bumps that just aren't quite right. Thank you so much for watching this video. I'm really honoured to have been able to talk about gynecological health today with you all.
And I'm really chuffed to have been able to show you my bits. But seriously though, this is a really important topic.
Yep, just fly that fanny flag, like get some pussy power, learn a few signs and symptoms, go to the doctor if something isn't normal. It's probably nothing serious, but it really is better to be on the safe side, isn't it, Tracy?
It certainly is. And you know, if you're not confident or you're a bit worried or embarrassed even about going to your GP, ask Eve.